Welcome, everybody. It's time for the most highly anticipated portion of the Neuromod Symposium, the Voice of the Community panel. Once again, I'm Dr. Saydra Wilson, and I get the pleasure of moderating today's panel. And the voices that we are going to listen to today are the voices of people with lived experience with implanted devices. So our voices of the community are implanted device patients today. I'm gonna lay down the ground rules. Both of you have talked to me before, so we'll pretend like we're just having a normal conversation and that I've forgotten lots and lots of things about you, so you guys can fill in the blanks for everyone else in the room. You're allowed to pass on any question that I ask you. And we have an entire hour and a captive audience, so don't feel like you need to cut yourself short if there's an answer that you think is really important. That sounds good? Okay. So I'm going to ask you each to introduce yourself and then describe what device you have implanted. Would you like to start?
My name is Sandra. I have a vagus nerve stimulator that I had implanted for treatment-resistant depression.
My name is,
Closer, please.
My name is Logan Forty. I have the DPS system for OCD. Yes.
Cool. So Sandra and Logan have two different experiences. One having a vagus nerve stimulator device implanted under insurance support, and Logan having the experience of accessing his device through a research clinical trial. So I've got some icebreaker questions here to get us all started. So Logan, what was your initial impression when you first started considering a surgical intervention for your OCD?
Well, first I went to Rogers, and that's supposed to treat it. OCD. First it was pretty productive for about 4 months, and then everything started coming back. I kept trying to battle it. It got back to its original stance, its original position. And my psychiatrist actually recommended Dr. Widge, and we talked about this, and eventually this is what we decided on. It took a while to actually implement this, but yes, I eventually knew this was the right thing to do. And it was about 2 years ago, I think, I got it done.
Wow, it's been a really long time since I've seen you. Sandra, same question. What were your initial impressions when you first started considering a surgical intervention?
So it had originally been brought up while I was undergoing ECT because I had a pretty effective response to that, but I had a number of side effects, so it was pretty clear it wasn't going to be a long-term plan. And we discussed initially that it can be a process to get it approved with insurance. So while I was still undergoing ECT, we started that request, and I think ultimately it went through 3 rounds of appeals before it even got approved. So by the time I had the option of having it implanted, I had reached a point where I was less interested in doing ECT. It was really impairing my ability to continue working, and I also had started to have a lot of anxiety for the actual procedure. So I was really ready for a more sustainable long-term plan to be implemented. So by the time I got the approval, it was kind of a no-brainer.
Now, Sandra, was it easier for you to consider an implant because you had previously experienced neuromodulation?
Yeah, I had kind of a proof of concept that I could get response and that my depression would be improved from having some neuromodulation. So I've been told that there was research that supported that if I responded well to ECT, that there would be a likely benefit from having the vagus nerve stimulator. And especially at that point with my depression, I was still kind of playing fast and loose with my overall well-being. And so I was willing to kind of roll the dice that it might have a good outcome.
Thank you. Now, Logan, you had no previous neuromodulation experience. You went from medications and psychotherapy and evidence-based psychotherapy from OCD to brain implantation.
That's correct.
Can you describe for everyone what your symptoms were like and how they impacted your life prior to implants? Because there's a lot of misconceptions about OCD out there in the world.
Well, I couldn't stop washing my hands with everything. I always thought I was dirty all the time, no matter what I did. I was still able to go to the gym, but it was incredibly difficult. I probably would sanitize after every set. It just got to be too much. Showering was difficult. I just feel like everything in general was just way more difficult than it had to be. Let me see, I remember the first time when I got this device, the first time I actually touched the flusher by itself, like to flush the toilet. I've never done that for like 10 plus years. I didn't even realize I did it, and I was like, oh, I didn't even realize I did it when I did it, and I was pretty shocked. I was actually able to do that. And yeah, I have bipolar as well, and so having both definitely, yeah, it was pretty terrible. But yeah, I'm sort of not answering the question as good as I could probably. Yeah.
Don't worry, we got lots of time to go over this again, especially when you get to talk about your photo finish.
Nice.
Sandra, would you like to describe life pre-implantation?
Sure. I had depression throughout my late adolescence, through a lot of periods of my adult years. And it had gotten to the point where I had been hospitalized a number of times and had agreed to start ECT. When I initially had begun that, I had periods of aphasia, which was really frustrating to know what I was trying to say and not be able to communicate to my family. It required me to be dependent on having somebody to transport me to and from. I wasn't allowed to drive. I don't have any recollection of the month of February of 2020. I've been told I did not miss out on much. But it's surreal to have periods of my life that are kind of redacted from my own memory. I have pictures on my phone. I had emails that I didn't send. And so it was at this really volatile, vulnerable time when I was trying to just cope. And I had tried to move away from doing ECT. I had ketamine therapy, I had transmagnetic stimulation. ECT seemed to be the most effective thing for me, but it interfered with my ability to work. It impacted my sense of direction. I would go for a walk in my neighborhood and get lost. So there was a lot of trade-offs, and it was this idea that I was doing this thing that was supposed to help me want to stay alive, but it was kind of this dark, unspoken secret that like people don't really talk about. And even when I had got to a point where I could space out the treatments and had done some like neuropsych rehab to be able to return to work, I still felt like I had this kind of shameful burden to keep. So when the opportunity to have something that was more compatible with a more full life, that was really, really appealing.
Okay. So both of you have described pretty severe impairments in functioning prior to considering surgical implantation for mental health conditions. And how did your doctor respond to you guys telling your story of severity of illness? They said, great, we're gonna go on a very long journey together. Most people experience their mental health provider as having brief appointments where they describe symptoms, and the psychiatrist pulls out a prescription pad and hands them a prescription, and they go directly to the pharmacy and try out this new treatment. But when we're talking about surgical implants, the process is much, much, much longer. The process includes evaluation of symptoms, then interaction with your insurance company or enrollment in the clinical trial, implantation of your device, and then activation and actively being able to turn your device on. Throughout these steps, evaluation, insurance, implantation, and activation, what part of the process was most difficult? Logan, you can go first.
I don't know. Honestly, I didn't think it was that difficult because it was impacting my life so significantly. I mean, having OCD and bipolar, it's almost like I don't know why I was plagued by both. So I knew since Rogers worked but then didn't work, then 4 months later didn't work, I realized I had to do the best I had to realize I had to, DBS just seemed like the best option. I didn't think it was gonna do it because I wasn't even scared at first because my life was so, nothing was working like it was supposed to. So I knew I had to, it's pretty drastic, honestly. I knew I had to, I just knew I had to do whatever it took to get better because I couldn't deal with the combination of the bipolar and the OCD. And this device really, it really tackles you. It's like a two birds with one stone, like a direct hit. I didn't know it was going to benefit the bipolar as well as it does. I'm extremely grateful for that. And it's I'm very grateful to have someone like Dr. Widge and Dr. Darrow on our side. I'm very grateful for them a lot.
Thanks for sharing that. And I'm sure Dr. Darrow and Dr. Widge are happy to hear that here with us today. So you were describing that even though the process was prolonged, it didn't bother you because you had such a strong belief in the end goal. And you were able to partner with both your psychiatrist and your neurosurgeon to see that goal through to the end.
Yeah.
Now, you have a slightly different path because you were working with your insurance.
Yeah.
So what part of those stages was most difficult?
It was really frustrating because of the duration of the rounds of appeals. It was an over 2-year process. We had submitted letters of medical necessity. We had tried to get me enrolled on the small non-Medicare portion of the large study that was going on at the time. And so it was really frustrating to have all these barriers when the insurance, it was never about it being concerned for ineffective. It was really just about the cost, that they just didn't want to pay for it. And it was really interesting to me that the point in which I got approval was when I changed departments and then I didn't have eligibility to an insurance plan that didn't have a deductible. Once I had an out-of-pocket deductible, all of a sudden they said, okay. Still worked for the same employer the whole time, same insurance company, different plan structure, made a difference in whether or not I was eligible for a device that ultimately has made a huge difference in my quality of life. But I did appreciate that Dr. Widge echoed my frustrations with the insurance companies over it. It felt nice to not be solitary in my frustration, that it was a ridiculous situation and that I wasn't alone in that.
Mm-hmm. Now comes the fun part, where you get to describe what's different in your life now that you've had your device and all the things that your VNS device has made possible for you.
I've had my device for a year in October, and I feel like we got to a really effective setting on it probably after August last year. And I've gotten to the point now where not only am I not trying to navigate and battle day-to-day symptoms of depression, but I'm finally at a point where I am really able to make long-term plans and have and be able to sort of celebrate those victories in it. Over the course of my depression, I had accumulated a lot of personal consumer debt because I wasn't forward planning. I was just trying to deal with things as they came up day to day, once I got to the point where my depression wasn't kind of calling the shots on how I live my life, I was able to really set a budget and make long-term plans. And over the last year, I paid off like $22,000 of consumer debt that just was unfathomable when I was still trying to just get like through the day or through the week.
Congratulations. And I just want to point out a few things about your experience and your journey that is typical of the vagus nerve stimulator process. While your 2-year-long insurance approval process was slower on average than most of the patients that I care for, your onset of treatment effect was more rapid compared to most of the patients that I cared for. So understanding that vagus nerve stimulation takes weeks to months and maximal impact over the course of years is more typical in the real world. We'll sneak back over to you, Logan. You had already started to share with us some of the functions that you were able to regain in your life and some of the things that your DBS has made possible for you. Can you talk a little bit about what the experiences were like during the programming of your device and how they tried to get you to your new state of functioning?
Mm-hmm. Well, I remember I was, before I had the device, I was late for everything. I've been fired over 10 times. When I was in college, I was late for 90% of my classes most of the time. When we first started actually doing the DBS, it felt like you could actually feel yourself getting a little, I don't want to say high, but it felt really good when they were programming it. And yeah, I mean, ever since I've gotten it, it destroys the bipolar low, which is actually pretty shocking to me. I didn't know it was actually going to do that. So that was a good, let me see. Yeah, so I have this, since I couldn't hold down, I actually have a job right now. I couldn't hold down jobs for the longest time. I work in an assisted living place right now, and it's pretty gross, and I'm surprised I can actually do it. Just in general, I work in dining right now, which isn't appealing at the moment, but right now it's probably, honestly, one of the best stepping stones ever. I actually have the ability to carry people's dirty glasses without gloves, which is absolutely shocking. I have no idea how I'm able to do that. Because everyone else actually wears gloves, and I'm the only one that doesn't. So it's actually, I don't feel the need to wear them either. So it's definitely insane. It really is. This is the best decision I've ever made in my life for sure, because I wasn't getting anywhere in life, so I knew I had to do something drastic. Like I said, I'm kind of going off the question a little bit.
It's your time.
I remember, for sure. Yeah, when I first started getting programmed, it feels amazing, especially if, like, Dr. Widge and we didn't know it was actually going to benefit the bipolar as well. So when it did that, I mean, now I think I get to live a normal life for the first time. I didn't think I was ever going to have that opportunity. So I'm extremely grateful. Things I'm able to do, like I do, let me see, sorry, I'm kind of unorganized here. Like I'm able to do jujitsu, and I love that I'm able to do that, because if your OCD was bad, there's no way you'd be able to do that. Especially with all the chokes, like a triangle choke, for example, it's really, yeah.
Close and personal.
Yeah, it's about as close and personal as you could think. Yes, I've gotten people's blood on me. I've gotten people's sweat on me. Their saliva is awful, and it doesn't even bother me that much, which is absolutely amazing, which is weirdly amazing, I should say. I used to have to wear gloves when I was doing my own laundry, and now that's not even an issue, not even at all anymore. And I wasn't going to stay at the hotel. I stayed at the hotel. I wasn't going to stay here, but because hotel beds were like a nightmare, because I would wear a sweatshirt with the hood up, socks. I didn't want my skin to touch it, and yeah, I wore a short sleeve shirt, and my skin was touching the bed. So that was good. It's ridiculous that's like a milestone. It's absolutely absurd. But yeah.
DBS opened up
DBS,
a lot of the world to you.
Yeah, it really did. Yeah, I actually think I get to make something of myself, which is really nice. I didn't think I was ever going to have that opportunity. So yeah, I'm looking forward to what the future has in store for sure. For the first time, I didn't think I was going to have much of a future. It's going to take time, but yeah, I'm definitely going the right direction, and it feels great. Yeah, I'm incredibly. It was a risk. I'm a risk taker, but this is the best risk I've ever taken in my entire life for sure.
Now, Logan, your results are phenomenal.
Yes, that's an understatement.
Not very many
No.
people have had a DBS put in with the comorbidity of bipolar disorder. And while you did have a typical response of being able to feel an actual emotional reaction during the programming process that gave you signals that we were moving in the right direction, you really get to be the poster child of DBS for OCD at this time. And my follow-up question to this is, all of this good, all of this improvement in functioning came at what cost? What type of complications did you experience from your DBS implantation?
Basically, maybe the recovery from surgery, which to me is just nothing because I wasn't accomplishing anything to begin with in the first place. And so obviously recovering from surgery, it's painful, but it's very small price to pay for sure. That's about it. Otherwise, it's mostly just pros with almost zero cons.
And how about you, Sandra? What complications or side effects did you experience from your implantation and treatment process?
Really pretty minimal. I did find that I should have taken more time off of work when I first had it implanted. I knew it's a small device and it's not a very big incision, and that it's done outpatient. But I didn't anticipate that there would be as much swelling and discomfort that would take. It took about a week to get to a point where I was really comfortable and it wasn't painful. So I just wanted to have a little bit more heads up so I could plan accordingly. I got it on a Wednesday. I worked from home Thursday, and then I went back to work Friday. And by the end of the day, I was so miserable. I was in so much pain that just knowing what I know now, I can be better prepared when I get the battery exchange of sort of what to expect. It's amazing how much just having an appropriate sports bra that goes high enough to cover where the device sits to help with that swelling, that was more effective than any pain meds. Was just to have that compression. And I was like, that would have been a really, really good pre-op instruction. But I had, the only real issue I had with the VNS since it's been programmed is when I got COVID, I lost my voice for the better part of a week and a half, 2 weeks. And then every time it would cycle on, it would have that vocal fry where it just seemed like I had been up late smoking cigarettes and drinking whiskey, and I just didn't feel like that was the professional vibe I was trying to give. And so I had the settings tweaked to have it be less impactful in my voice, and it hasn't been an issue since then. And so whatever settings we have it at now seem to be working really well.
So what Sandra was describing was the healing taking place after the implantation of the VNS pacemaker device in the upper chest wall. And there is a brief period of restricted activity immediately after the surgery, and for things like lifting up overhead and lifting weights heavier than 20 pounds, which goes on for about a week or so afterwards. And the hoarseness that you describe when your stimulator is active, because remember the vagus nerve stimulation device is not constantly active, it turns on and off on a fixed programmed cycle, and the hoarseness can be present when the device is on, and that's a very common side effect that actually doesn't seem to plague you too much unless you're sick.
Yeah. Every so often, I will notice that it cycles on, and I have to kind of put a little bit more effort into making the sounds steady and even. I sometimes have to talk for long periods at a time, and I'll notice it more. Sometimes my husband will notice it, and he says it sounds like I'm purring because it's a little bit of an oscillation. But by far, it's really like such a better benefit than barely being able to like get out of bed.
Speak.
Oh,
go
I'm sorry.
ahead.
I'm glad it doesn't impact what I can do. I can still run. I can still go to the gym and lift weights. I thought it would affect that. That probably would have maybe changed whether or not I would have done this. But I can pretty much do everything I did before, which is great. So that's, yeah. That was a huge pro. I thought there'd be some limitations, so I'm extremely grateful that there isn't. For the most part, no, I don't think there's any limitations, so I'm very grateful for that for sure.
I've got a question lined up just for you, sir.
Okay.
What is the one thing that you wish the manufacturers of your device knew or understood about what you need in life?
Maybe if it would last a little longer, because I need to have another, I'm going to call it maintenance surgery. I need to have that done pretty soon. Because that was only about 2 years ago, which is, I knew that to, like, Dr. Widge and Dr. Darrow, they were very, like, straight shooters. They were honest about everything. Very grateful for that. So they told me it'd be about 2 years until I would need the maintenance surgery. It'd be nice if it, like I said, because I know they have, like, rechargeables. It would have been nice to have that at first, but that's it, though. Otherwise, everything about it's perfect, except if it would last longer.
So both of our patients do have implants that will run out of energy at some point during their lifetimes. So maintenance surgery is a requirement and a very important part of the evaluation and treatment discussions before surgery happens, because you're not signing up for one single surgery. You are potentially signing up for a repeat surgery, which could be as often as every 2 to 3 years, or as often as every 8 to 10 years, depending on your device. So it's not choosing your device once, it's choosing it over and over again when you get the opportunity to have a device put in early enough in life that you have lots of life ahead of you.
I mean, even if there was no rechargeable, I would still be willing to do that, because at least I'd be able to live a normal life. I mean, during, obviously, the recovery process from the surgery would be unfortunate, but it doesn't matter. There'd be way more benefit, so I still think it'd be worth getting it, even if that wasn't an option.
Yeah, I kind of feel like it's like that I'm getting to opt into being able to effectively treat this otherwise like potentially life-limiting condition that I've been trying to navigate before, that there's a choice that I can make that allows me to kind of take control of that. And on the bonus side, now I'm technically a cyborg, so I've just upgraded.
Yes, technically a cyborg, upgraded, have implantable materials that do bring some very mild limitations to life, especially in the context of needing MRI scans. But how often do we really need those?
That was actually one concern that I talked to the surgeon about beforehand. At the time, I was working as a bedside nurse with a pediatric population, and occasionally we would take them down to MRI scans. And so I was concerned about whether or not I would be able to be the nurse to take them down, or if I'd have to like swap out with coworkers. But my understanding was that it's not metallic enough to warrant not needing to be in the room. So it didn't even have implications for like this very narrow field that I was working in.
And do we set off the metal detectors at the airport?
I have not been to the airport yet since I've had this. So,
No, but
I mean, if it does, I'm expecting. I mean, they give us this card, this Medtronic card, so I'm assuming there's going to be a whole thing. Yeah.
Not the metal detector, but I think it does look weird on the magnetic scanner thing. I think there's just like a density that they're like, what? No, who cares?
And then you whip out your device card if you ever actually have to have a discussion about it. Now, something that people underestimate in the world of implantable devices is the fact that you are going to need support during the evaluation process, during the waiting process, during the healing process. And I wanted to understand how you approached letting people in your life know about your device and how people reacted.
Well, I always had the luxury of having a lot of supportive people in my life. I have a good family, I have good friends. I know not everyone has that luxury, so I was very grateful for that. And I hang out with a lot of good people, and they were all very supportive of everything, very empathetic, so I'm very grateful for that. But yeah, also along, like kind of randomly with kind of similar to your depression, bipolar lows are intense, and I know there was a risk of mania as well. But this destroys the bipolar low. Like even if I'm still feeling like super like awful, everything's just more bearable, way more bearable than it was. Yeah, so I'm actually able, like probably like a normal person low. So that's amazing. And yeah, I have not got manic, so that's really good too as well. Yeah.
Was it easy to convince your parents that you were on the right track, or did they have different concerns compared to you?
They were immediately convinced. They knew something had to be done. So, yeah.
And was it different for you?
No, I mean, I found that because it's not a widely known device, like a lot of people don't have their own understanding or perception of it, that I was relaying the information that I had gotten from the psychiatrist and the surgeon about what it is and how it works and where it goes and what the risks are. Even when I went for my like pre-surgical physical, like the my primary care provider is like, I don't know the first thing about this device. Like, tell me where it goes and how it works, and I'll assess accordingly. But in terms of like having the support for it, thankfully I have a really phenomenal husband that has been through the worst of it, and so this was far less stressful for him than when he's checked me inpatient or having to make sure that I was safe and other like things that thankfully I feel like we'll never have to deal with again. But I could see how, you know, if people are not in a supportive environment where they don't have that person that can take them home from having anesthesia, that can be a real barrier for them. Just even though they might have all the elements able to facilitate independently, some people just don't have the same support systems in their lives, or their support systems might be more remote, and that can really be a factor.
Slightly off in left field, but we're talking a lot about your devices today. Is it unusual for you to spend this much time in a regular day thinking about your device or even sharing it with others?
You want to go first?
Sure. Every so often I'll like joke about it, or I'll notice that it comes on. When I first had it programmed, we had gone to the orchestra, and it was kind of an unusual sensation where I could feel it cycle on. It would feel kind of like having butterflies or like your heart racing. And I was like, I know it was really a good performance, but I don't know that it was that good. And so it was just sort of like, kind of like going in and out of that moment of like, oh, I am very aware of my body right now, but then also being able to just be still and enjoy things. Every so often, I'll feel it come on, and it's like a little bit, kind of feels like pulled, like when muscles are really tight, and if I just sort of adjust the position of my neck, that it will release that tension. And so sometimes I feel like I'm just having kind of like a weird tick or something, and it's just to accommodate how that device is triggering like in that particular position. But for the most part, it is just, I can go about my day. It's so much less of an impact than the other kinds of things that I was doing beforehand. It doesn't, like the trade-off for it is so much less than all the other treatments that I had pursued awaiting this approval.
Can you repeat the question one more time? I'm sorry.
Sure. I was saying that we are talking a lot about your device right here, but I wondered in your regular everyday life, how much time do you spend even thinking about your device or explaining your device to other people? Is that part of your normal conversation?
I'm so used to it, I can't really even feel it. At first I did. When I first had the surgery, it felt a little unusual, but my body just adjusted to it, which is, I feel like, it's just going to happen. My body adjusted to it completely. My friends know about it. Some of them like telling people, and then I have to explain it. It's usually pretty brief. It's usually pretty brief for the most part. Sometimes people really want to know more in depth, which I have no problem doing. But yeah, for the most part, it doesn't really, I like that it doesn't really, sometimes I almost forget that I have it sometimes, because like right now I can't feel it at all, which is really nice. So it's very comfortable, so that part I really like too, because I thought maybe I'd be able to feel it at all times for the most part, but I like that it's very, very, very comfortable.
So it integrated into your life well, not only in the fact that it helps manage your symptoms, but you really don't walk around thinking about it every second of every day or worrying about it malfunctioning.
Correct.
Well, I think the time has come for us to transition to audience questions. If you guys have a question for our patients, remember, we'll raise our hand and start running mics around. And remember, you guys have the option to pass on any question that you like.
I'll answer anything. So, so I'm not, I'm nervous in general about, I'm good. Sorry.
I agreed to this because I feel like there isn't enough information about what it's actually like to have a device. Before I got it implanted, I went online to try and find pictures of like what the scar would look like. Or there's a lot of information about it, the VNS used for epilepsy, but the information about the use for depression was really just journal articles.
There was a huge discrepancy between what physicians thought patients held them back, right? And particularly was the stigma of getting a stimulator. And I was wondering if you guys could address what you saw as the stigma or lack of stigma of getting a device like this.
I really didn't care about the stigma if there would be any. I haven't really faced any for the most part. When I first told my parents, they were a little confused about it. They didn't really understand it too much, but they knew it would the benefit would be absolutely, well, hopefully, crossing their fingers, it'd be great. I know, like the whole cyborg thing, I've had a lot of jokes about that too, because it's true. I'm not going to deny that. But so people would bring that into it. They would try to, I don't even know the logic. They tried bringing that into it. No, not too much stigma for the most part. And if there is any, I really don't care. I needed this. This is extremely beneficial to me. So I do not care about any sort of stigma for sure. Awesome.
When I had considered it, when I had initially started ECT, I was inpatient, and they had said, we think this would help, but the only prior knowledge I had of ECT was from One Flew Over the Cuckoo's Nest, and at that point I was inpatient because of suicidal ideation. I really didn't have a very high regard for my life, so I was like, sure, we'll try it. It probably won't make things worse. And then it kind of helped, and so then I agreed to do more of it. So then when the option, and we started discussing having a vagus nerve stimulator, I feel like I had already bought into the most extreme treatment, and so doing something that was less downtime, less invasive, less stigmatized was a no-brainer. But if someone were to say, you have parents with a history of mental illness, you're at risk for this, and we want to preventatively put a vagus nerve stimulator in, I think that buy-in would be a lot harder, because it would be more difficult to measure if you were getting a benefit from it, if you prevented it from ever happening. And it would, the invasiveness of it, I don't think would have a trade-off. But once you're already at that point where it's impacting your functioning day-to-day, your life, your outlook. I earnestly didn't expect, I really felt like depression would probably be what led to my demise. And now that I have this, I am
worrying about, am I saving enough for retirement? Like, that wasn't even on the radar before. So it's definitely well worth like the low level risk to it.
There's hands over here and one here.
Hi, thank you very much for sharing. I was just wondering, do you have to be on any medication or do the devices completely control?
I'm actually, I'm slowly going off of lithium. I've been taking lithium for like 11, 12 years, and I hate it. So I'm almost off of it completely. I actually have an appointment with my psych. I was on 1,500 milligrams of lithium. Now I'm only on 300 in about 2 weeks. I should actually be completely off of it because of the device, so I'm grateful for that, because lithium is probably the least favorite drug of all of them that I all take. I still take the Lamictal, lamotrigine, and the Latuda, but I'm okay with taking those two. If I don't have to take the lithium, that's great. So I still have to take the meds, which is smart, because I can't risk a manic episode, because my manic episodes are terrible. So yeah, the fact that I don't have to take the lithium anymore very soon, I've had no signs of mania at all, so that's, yeah.
I'm an outlier on this in that I actually am not taking any antidepressants, so it's not to have that expectation for it, but it had gotten to the point where it really has brought up sort of the basement of like where my lows would be, to a point where, I still have a range of emotions, but they're not to the point where they're derailing my life. And so I had slowly gone off Wellbutrin to the point where I just wasn't on it anymore, and things were going well. And I've started being able to exercise regularly and get better sleep and do all of those like health maintenance things that I knew empirically would be beneficial to my mental health. And I do lean heavily into those routines now, but I was never at a point where I could actually sustain or implement any of those really healthy behaviors prior to having the device.
Thank you.
And just to add on to what Sandra said, she is an outlier. The FDA indication is that your device is meant to be a helper along with standard therapies like medication and psychotherapy. So.
Oh, I still have a very good therapist.
Next.
I walked in like 5 minutes late, so I didn't catch your names.
My name's Logan.
My name's Sandra.
Sandra. Logan and Sandra, thank you so much for coming and doing this and answering our questions, because I'm a PhD student. I don't get to talk to patients super often, so it's a great experience for me. And I work on vagus nerve stimulation, so I have a question for you, Sandra. When you said that you move your neck when you have that feeling of tightness and it changes it, if you moved it back, would it come back? Or have you played around with that, and what have you learned?
Yeah, so I think mine cycles on for about 30 seconds at a time. So usually during that period when it's on, if I were to go back to that like original position, I would still feel that sensation. But it's usually just by like kind of chinning down, it releases that tension on that, like where the lead sits.
And then my second question was, you said that there was a time where you kind of had the throat sensation and they changed your parameters. Did you notice any changes in the benefits that you were having after that happened?
It's hard to say because it's such a slow and gradual improvement from having the settings or from like where the parameters are set. But I did notice that after that time, when we had adjusted to try and avoid that vocal impact, that I seem to be getting like a more optimal benefit. Like I feel like my depression and overall functioning, it was after that change that I had weaned off of the antidepressant that I was on. Before that, it was still kind of the pairing of both of those together. So, I'm aware that there's always the potential of like a placebo effect in this, but even a placebo effect can still have benefits. So if it took putting a battery in me to get that, then I'll do it again.
And the positional nature of discomfort is pretty common in people with vagus nerve stimulators. While there are not nearly as many possible changes in parameters for a vagus nerve stimulator as there are for a deep brain stimulator, so your programming appointments are much shorter. We do find that I can set your device in the clinic and in the office and then set you off on your way, and you go home, and for the first time you lie flat. You get a completely different sensation than if you were sitting up or if you had your chin turned and you were extending your neck in some way. So we sometimes will have people come back after their programming just to manage comfort in the lying down position or preparing for sleep.
Very cool. And then if I could just ask one last really quick question. Could you tell me about so we already kind of went over cons, but could you tell me any cons you have with like the scarring from the actual procedure? And that's for both of you, actually. I'm just curious.
Yeah, so I actually have some body modification on my chest that I had for about a decade, actually close to 2 decades before I had the device implanted. So I was concerned about how visible the scar would be, and we agreed to have it kind of line up with where the existing scar already was. And so that has healed like beyond what my expectations was. I was really surprised by the appearance of the neck scar when I first had the surgery. It was really apparent, and it was really like bruised, and it looked like Frankenstein. And I was concerned because I know that my body can scar visibly, and I was worried that it would have just more noticeability, but within, I'd say, a month, it had faded to the point where it was really unnoticeable, and I just have to be more mindful to make sure to put sunscreen over it. But in terms of like where it sits, I have coworkers that work closely to me regularly and never even noticed that I had anything there. So in terms of like the cosmetic effects of it, even though I feel like I'm probably sort of in the middle of wound healing, like appearance and aesthetics of it, I found that it was like a really satisfactory outcome.
I think the scarring's fine. I think it actually looks kind of cool. So there was a period where I didn't see Dr. Witch for about 3 months, and I had my head buzzed. I didn't want him to think it was getting manic, because I wanted to see what the scars looked like on my head. And it looked pretty cool. Not good enough to keep my head buzzed, but it looked. I don't know. I think they look fine. I don't think they look bad at all. So I'm fine with the scars.
In some ways, I actually appreciate that having something that is considered like an invisible illness, like depression, actually has like a physical indicator that is, something that is noticeable or a conversation piece with other people, because so often like mental illness, like people just assume, oh, you look fine, you must be fine. No, I am falling apart inside. But and part of me, that was part of the buy-in actually in terms of getting the device, is that no, like there is something wrong and I'm actively trying to fix it.
While folks are getting the mic for their next question, I will sneak one more question in. So one of the features of your vagus nerve stimulation device is you do have a small element of control. You have a wrist magnet that you can place over your pulse generator and stop the stimulation for as long a period as you need to. Do you find yourself ever using your magnet, and what kind of situations cause you to use your magnet?
Yeah, in my prior settings, I did use it from time to time, because I often will be speaking for long durations at a time, and that effort to kind of overcome that little bit of like vocal change. In the old settings that I had, found that sometimes if I was getting more fatigued, that it would sound like I was congested or coming down with something, and I didn't want to give the perception that I was a risk of getting someone else sick. And so I would actually put my magnet on like my lanyard so I could position it over where the device is, so that I could turn it off without having to like just sit here and act like I'm trying to beam myself up.
Hi, thank you guys so much for talking to us. I love, I find like patients doing better so like motivating, and it's really awesome to hear from you guys. Would you mind talking at least like briefly about some of the most helpful like clinical discussions you had with your care team and like why you feel they were beneficial?
Oh, okay. One more time? I'm sorry. Just
Sorry.
no, it's okay.
Would you mind discussing like some of the most beneficial discussions you had with your like healthcare team and like why you feel they were really helpful in terms of like deciding to get this device and like moving in that direction?
We talked about, because the fact that I went to Rogers and it worked at first. It worked at first, and then everything came back. So we just discussed. Oh man, sorry. We discussed all like the pros and cons of the DBS, and everything that could go potentially. Nothing. I'm sorry. I'm kind of struggling right now. I'm sorry. You wanna go with it?
Sure.
I'll give me a little bit.
The initial conversation I had with the psychiatrist about why the VNS was being recommended to me was there was some data to suggest that in patients who had had a response to ECT could see benefit from a VNS. And so that was, and even though it wasn't like necessarily a majority of patients that saw benefit, like even if it was a smaller percentage, the fact that it doesn't, that it's not like it's going to cause weight gain or that it's going to have a lot of other side effects was really appealing to me. And then in terms of having the device placed, the conversation with the surgeon, the risks that were explained were that it could potentially like impair your vagus nerve if it was like too tight. If the cuffs were too tight, it could cause swelling. It is located close to your carotid artery in your jugular vein, and that could potentially, like if something were to slip, but the surgeon who's implanting it is a neurosurgeon, and so in terms of risks and what they do, like a vagus nerve stimulator is very low level compared to the brain surgery they're doing all the time. So in terms of my confidence interval on that, I was like, I felt like I was in good hands to have somebody doing this, that this is, just a routine outpatient procedure.
Honestly, if there were any sort of risks that were talked about, I didn't care. I wanted a life. I wanted a life so bad, so I just said, I got to do what I got to do. And it was, yeah, I've said before, it was the right decision. I'm very glad I made the decision, and the risks were definitely, it was worth it, for sure.
Now, to the both of you, how important was it that you had sources of information other than your direct psychiatrist, Dr. Widge, when you were making this decision? Did you feel like you needed to look for resources outside of the clinic? Did you find any particularly good resources outside of the clinic, or didn't matter?
Didn't matter. I looked a little bit with my psychiatrist about all like the pros and cons, but at the end of the day, it didn't really matter. I needed a life, so I did it, and I got one, so it's awesome. So there we go.
I had looked at other resources, in part because during this like appeal process, there was an announcement from the U that Dr. Widge had been like approved or was some part of some board with the medical devices, and I was like, okay, so he has a vested interest in putting devices in people, and I'm aware of that. So I had looked on like resources like Up to Date and things that are widely available that will take information from a variety of sources and report on that, and that information aligned with what he was telling me, so that so I did my own kind of independent check on that. But even those resources aren't necessarily something that everybody has. It's a pretty frustrating Google search. Like I had to kind of dig to find information. I had to know what the device manufacturer was to go looking for what the information was from them. I do wish that information was more readily available. I was mentioning, like if you look on like TikTok or Instagram for vagus nerve stimulator for depression, there's like almost no tags because it isn't something that people are familiar with. It's, it's still a pretty small population that has it in. But that's one of the reasons why I agreed to to participate in this is because I feel like having that information destigmatized and more widely available helps make it accessible for people who would really benefit from it.
And Logan, you didn't get to have this experience because you were going through an experimental treatment, so there were not too many other people ahead of you in line who'd had the experience. Did you get a chance to speak to or read anything by any other patient who'd had a vagus nerve stimulator before your implant?
No, I knew some nurses that worked in pediatric populations that had them for epilepsy, and they were impressed by their benefit, but I knew that the settings and how it was used was different for depression. So I did have, there was definitely a little bit of like blind faith in it.
Okay. Looks like we have a question.
Actually, that was my question is about resources. And do you ever interact with other people that have implants like yours? And if you do, what have you gained from those interactions? And if you haven't, do you feel there would be value in some sort of a support structure or communication forum where people that have implantable devices can openly communicate?
I have not had other interactions, but I think that would be cool though. I definitely would.
I haven't had anyone yet. I did have somebody that was wanting to talk to somebody, and I provided my contact information and said I was happy to share what my experience was, but I never heard back from them, so I don't know where they were in terms of if they changed their mind or just weren't comfortable reaching out. But thankfully, I'm a pretty outgoing person, and so I'm like more than happy to share.
Would it have been more useful in the pre-implantation waiting phase to interact with other people who were going down your path, or only useful once the implant's already in?
I would have liked to have an audience with the insurance company and express to them what their delays were impacting in my life.
Over here.
Hi, okay. Thank you both very much for sharing your experiences. Actually, Logan, I was a medical student working with Dr. Widge around the time that you got implanted. You might not remember me, but I remember you. And yeah, it's very powerful and emotional to see how well you're doing, so that's great. I'm wondering if ever there are any times where the device turns off or the settings turn off or something, and how quickly, if this happens, how quickly do you notice certain symptoms return? And if they don't return, is there ever like any consideration about in the future taking the device out or explanting?
I do turn it down at night. I find it easier to sleep when it's like that, and my OCD actually does get a little worse. But then in the morning, when I turn it back up, everything goes back to where it was. So and then it also jolts me up too, which is amazing. But yeah.
I'd like to just wrap this up by saying I want to thank, on behalf of the government officials that are here that help fund the research, the scientists, the device manufacturers that helped do this, and the psychiatrists that have been involved. That you guys are heroes, and you're really an inspiration to us. And I really thank you for doing this. And I think everybody, I hope, got as much out of this as I did. So really thank you.
Thank you.
Thank you.